The fluorescent lights hum in OR7 like a swarm of distant insects, steady and unrelenting. The smell is always the same, antiseptic layered over something older, deeper. Blood and fear baked into tile grout no amount of bleach can ever fully erase. Elena Navarro moves through the pre-op corridor with a mop bucket, wheels squeaking against the linoleum still wet from the night shift. She wears navy scrubs 2 sizes too large, sleeves rolled to her elbows. Hair pulled back in a bun so tight it leaves red marks at her temples by the end of every shift. No one looks at her. She is wallpaper, furniture, part of the infrastructure. The surgery board glows blue on the far wall, 4 cases lined up. Cholecystectomy at 7:30, appendectomy at 9, hernia repair at 11, exploratory laparotomy at 1. Routine. Elena's eyes scan the board as she passes, reading the names, the procedures, the attending surgeons assigned to each case. Her hands move on autopilot, wringing the mop, sweeping it across the floor in broad, efficient strokes. She sees everything. The IV pole in Bay 3 with a tinked line no one's noticed. The pulse ox sensor on the patient in Bay 5, positioned wrong, reading low because the probes rotated 15 degrees off the fingertip. The sharps container in OR4, that's 2 needles past capacity. She fixes none of it. Not her job. Not her place. A resident pushes past her without a word, coffee in one hand, tablet in the other. Dr. Marcus Trent, 29, chief surgical resident, 3rd year. Clean-shaven, expensive watch, the kind of confidence that comes from never being told no. He doesn't see her, hasn't seen her in the 4 months she's worked here. Elena steps aside, mop in hand, and watches him disappear into OR2. She returns to her work. At 7:15, the first patient is wheeled in. Male, mid-50s, consent form signed, prepped and draped. Cholecystectomy, Dr. Vivian Cardoza's case. Elena's in the corner of OR7, emptying a biohazard bin, when the surgical team enters. Dr. Cardoza, 46, attending surgeon. Steel gray braid, sharp eyes, movements economical and precise. She's performed this procedure 1,100 times. She could do it in her sleep. Behind her, 2 residents, a scrub nurse named Jackie, and an anesthesiologist adjusting dials on the machine, like a pilot running pre-flight checks. No one acknowledges Elena. She pulls the liner from the bin, ties it off, and sets it by the door. Cardoza steps to the table. The patient's abdomen is exposed, prepped with iodine, the laparoscopic port sites marked in purple ink. Jackie hands Cardoza the scalpel. First incision. Clean. No hesitation. The laparoscope goes in. The monitor flickers to life. Internal view. Liver edge visible. The gallbladder swollen and inflamed. Elena watches from the corner. Her hands are still. Her breathing is slow. She sees the liver. The color is wrong. Not much, just slightly, a shade paler than it should be. The surface texture just barely sluggish when Cardoza retracts the tissue. Perfusion issue, maybe. Elena's jaw tightens. She steps forward. 1 step, just 1. Jackie glances at her. Eyes narrow. Elena stops. Cardoza doesn't notice. She's focused, working through the adhesions, isolating the cystic duct. The case proceeds. At 7:40, the gallbladder is out. Specimens bagged. Ports removed. Incisions sutured. Cardoza strips off her gloves, drops them in the waste bin Elena will empty in 20 minutes. Textbook, she says to the residents. They nod. Elena says nothing. She watches the monitor as they wheel the patient toward recovery. His vitals are stable. But something in her chest doesn't settle. She touches the small silver pin on her collar. An eagle. Tarnished. Worn smooth at the edges. No one's ever asked about it. She's never explained. At 8:10, Elena's in the supply closet, restocking gauze packs, when she hears voices in the hallway. Cardoza and Trent. Did you see the schedule for tomorrow? Trent's voice, eager, almost excited. 3 trauma cases, back to back. MVA, GSW, and a fall from height. Cardoza's tone is flat. You ready? Trent laughs. Been ready. Elena closes the cabinet door softly, steps into the hallway. Cardoza glances at her, doesn't stop walking. Trent doesn't glance at all. Elena moves to the next task. At 9:30, she's mopping OR4 when she finds it. A surgical instrument. 10-blade scalpel. still attached to the handle, sitting on the edge of the instrument tray, uncounted, unwrapped. She picks it up carefully, checks the trash, checks the count sheet hanging on the wall. The count's wrong. She places the blade in the Charts container, logs it on the sheet, and moves on. No one notices. No one ever does. At 10:15, she's in the break room, eating a sandwich she brought from home, when Jackie walks in. Jackie's 26, nursing school graduate, 3 years in the OR. She's good at her job, but she's tired. Everyone here is tired. She pours coffee, leans against the counter, scrolls her phone. "You been here long?" Jackie asks, not looking up. 4 months. You like it? Elena shrugs. It's work. Jackie snorts. Yeah, that it is. She leaves without another word. Elena finishes her sandwich in silence. At 11:40, she's back in OR 7. Another case wrapping up. Hernia repair. Routine. The patient's stable, extubated, moving to recovery without incident. Cardoza's scrubbing out at the sink when Elena enters to clean. "Good case," one of the residents says. Cardoza nods. "Keep your techniques clean and they all look like that." Elena begins wiping down the instrument trays, her movements automatic, her mind elsewhere. She thinks about the patient from this morning. The one with the pale liver. The one whose vitals were fine, but whose tissue didn't look right. She thinks about the last time she saw tissue like that. Kandahar, a soldier, 22. Shrapnel wound to the abdomen, liver lac. She'd opened him up in a tent, with mortar fire close enough to rattle the surgical trays. His liver had looked pale. She'd found a fragment, tiny, embedded near the hepatic artery. If she'd missed it, he'd have bled out in recovery. She hadn't missed it. She never missed it. Elena finishes cleaning, wheels the cart into the hallway, and pushes it toward the elevator. Behind her, Cardoza's voice carries from the scrub room. "Make sure the post-op notes are done by end of shift." "Yes, ma'am." Elena presses the button for the basement. The doors close. The elevator descends in silence. She leans against the wall, closes her eyes, and breathes. Her hands rest at her sides. Steady, always steady. When the doors open, she pushes the cart into the storage room, logs the instruments, and starts the process again. Another day, another set of cases, another series of moments where she sees things no one else does and says nothing because no one would listen. At 6:50, her shift ends. She changes out of her scrubs, pulls on jeans and a jacket, and walks out through the service entrance. The air outside is cold. The streetlights flicker. She walks 3 blocks to the subway, rides it home in silence, and climbs 4 flights of stairs to her apartment. 1 room, a futon, a hot plate, a window. She makes tea, sits on the floor, and opens her laptop. On the screen, a medical journal. She reads for 2 hours. Then she closes the laptop, lies down, and stares at the ceiling. Sleep doesn't come easy. It never does. Elena wakes at 5:30 to the sound of sirens 3 streets over. She doesn't check the time. Her body knows. She showers, dresses, makes instant coffee that tastes like burnt plastic, and leaves by 6:15. The subway is packed. Bodies pressed together, breath fogging the windows. No one making eye contact. She stands near the door, one hand on the rail, watching the tunnel lights flicker past. The train lurches. A man stumbles into her, catches himself, mutters an apology. Elena steadies him without thinking, her hand on his elbow, fingers positioned precisely where the radial pulse would be. She feels it. Strong, regular, 70 beats per minute. The man pulls away, uncomfortable. Elena lets go. Old habits, the kind that don't fade. She arrives at Mercy General at 6:50. The service. The entrance is propped open with a cinder block. She slips inside, pulls on her scrubs in the locker room, and starts her rounds. Mop bucket, cleaning cart, the same route every day. At 7:20, she's outside OR 7 when she hears it. A crash, not loud, just sudden. She pushes through the door. Inside, a resident is on the floor, one hand pressed to his forearm, blood seeping between his fingers. Instrument tray overturned, scalpels scattered across the tile. The resident, young, maybe 26, first year, looks up at her, face pale. I slipped. I slipped. Elena's already moving. She kneels, pulls his hand away, checks the wound. Laceration. Deep. Radial side of the forearm. Blood pulsing but not spurting. No arterial involvement. She grabs a stack of gauze from the supply cabinet, presses it against the wound, applies pressure. The resident winces. I'm fine. You're not. Hold still. Her voice is calm, steady, the kind of calm that comes from doing this 1,000 times in worse conditions. She checks his pulse with her free hand. Strong, no shock. Pupils equal and reactive. You're okay, she says. But you need stitches. The resident nods, still pale. Elena wraps the wound with gauze, secures it with tape, and helps him to his feet. Go to the ED. Tell them it's a clean lac, no foreign body, needs irrigation and closure. He stares at her. How do you? Go. He leaves. Elena turns back to the scattered instruments. She kneels, fits them up one by one, checking each for damage, counting them, placing them in the sharps container. Her hands don't shake. They never do. Behind her, a voice. What the hell happened here? Dr. Trent, standing in the doorway, coffee in hand, looking at the blood on the floor like it's a personal inconvenience. Resident cut himself. Elena doesn't look up. I sent him to the ED. You sent him? He needed stitches. Trent steps closer, frowning. And you decided that. I decided he was bleeding. Trent's jaw tightens. You're not a nurse. You're not a doctor. I know what I am. The words come out flat. No anger, no defensiveness, just fact. Trent stares at her for a long moment. Then he turns and walks out. Elena finishes cleaning. She mops the blood, disinfects the floor, restocks the supplies. By the time she's done, the OR is spotless. No one thanks her. No one ever does. At 8:40, she's in the basement storage room, logging inventory, when the smell hits her. Diesel fuel, dust, heat. She freezes. Her hands grip the edge of the shelf. The fluorescent lights overhead flicker once, and she's not in the basement anymore. She's in a tent. Canvas walls, metal roof. The sound of rotors overhead, close enough to shake the ground. A soldier on the table in front of her. 19 years old. Leg shredded below the knee. Tourniquet in place, but the bleeding won't stop. The bones exposed, fractured. Infection already setting in. She can smell it. The rot, the death creeping up from the wound. Captain, we need to move him. Her hands are in his leg, feeling for the femoral artery, checking for proximal damage. The kid's screaming. Not words, just sound. We don't have time, Captain. She looks at the leg, at the bone, at the tissue that's already gray. If she doesn't take it, he dies. If she does take it without clearance, without anesthesia, without proper protocol, Captain. She makes the call. Scalpel. The medic hands it to her. She cuts. The kid passes out 30 seconds in. She finishes in 4 minutes. The leg comes off. He lives. 3 weeks later, she's in front of a review board. 6 months after that, her license is gone. Elena, a voice says. She blinks. The basement. Mercy General. Present day. Jackie's standing in the doorway, looking at her with something close to concern. You okay? Elena straightens. Let's go of the shelf. Yeah, fine. Jackie hesitates. You sure? You looked... I'm fine. Jackie nods slowly. Okay, just... Cardoza's looking for someone to restock OR4 before the next case. I'll do it. Jackie leaves. Elena stands there for another 10 seconds, breathing, grounding herself. Then she picks up the supply. Light card and gets back to work. At 10:15, she's in the staff break room, drinking water, when her phone buzzes. A hospital alert. Post-op patient from yesterday morning, transferred to ICU. Status, monitoring. Her stomach tightens. She opens the staff portal, logs in with the guest credentials she's not supposed to have, and pulls up the patient chart. Male, 54. Post-op day 1. Cholecystectomy. Vitals trending down. Blood pressure dropping. Lactate rising. Liver enzymes elevated. She scrolls through the notes. No imaging ordered. No re-exploration planned. Just monitoring. Elena closes the phone, sets it on the table, stares at the wall. She knows what's happening. She's seen it before. The patient's bleeding. Internally. Slowly. A missed clip, a perfusion issue. Something in the surgical field that wasn't caught. If no one goes back in, he dies. She picks up the phone again, opens her email, starts typing. Dr. Cardoza, I'm writing regarding the post-op patient from OR7 yesterday morning. His vitals suggest a possible internal hemorrhage or hepatic perfusion compromise. I recommend urgent CT imaging and surgical reevaluation. Respectfully, Elena Navarro. She reads it twice, then deletes it. No one would listen. No one ever listens. She stands, throws away her water bottle, and goes back to work. But she doesn't forget. At 11:50, she's in the ICU. She's not supposed to be there. But she walks in like she belongs, scrubs on, badge clipped, face calm. No one stops her. She finds his room, bed 12. The patient's asleep, intubated, sedated, monitors beeping softly. His blood pressure is low, heart rate climbing, skin pale. Elena steps closer, checks the monitor. Lactate, 3.8. Trending up. She looks at his abdomen, slightly distended, firm, internal bleed. She's sure of it. Behind her, footsteps. She turns. Dr. Trent. Again. His face hardens the moment he sees her. What are you doing here? Checking on him. You're not assigned to ICU. I know. Then why are you here? Elena looks back at the monitor, at the patient. Because no one else is paying attention. Trent steps forward, voice low, controlled. You need to leave. Now. Elena meets his eyes. He's bleeding. He's stable. He won't be. Trent's jaw tightens. You don't know that. Yes, I do. They stare at each other. Then Trent points to the door. Out. Elena doesn't argue. She walks. But she doesn't leave the hospital. She sits in the stairwell between the second and third floors, back against the wall, and pulls out her phone. She opens the staff directory, finds Dr. Cardoza's number, hesitates, then dials. It rings 4 times. Voicemail. She hangs up, sits there in the silence, and thinks about the soldier in Kandahar, the one whose leg she took, the one who lived, the one whose father called her a butcher in front of a review board. She touches the eagle pin on her collar, closes her eyes, and makes a decision. Elena doesn't go home that night. She stays in the hospital, moving through corridors, checking supply closets, pretending to work while keeping one eye on the ICU patient board. Bed 12 stays red, critical. By midnight, his lactate is 4.1. By 2 a.m., it's 4.4. No one orders imaging. No one calls for a consult. Elena sits in the chapel on the first floor, empty except for her and the hum of the ventilation system. She doesn't pray. She just sits, hands folded, thinking. At 4:15, her phone buzzes. Another alert. Bed 12. Status change. Blood pressure dropping. She's on her feet before the screen goes dark. The ICU is quieter at this hour. Fewer nurses, fewer doctors. Just the machines and the patients and the fluorescent lights that never sleep. Elena walks past the nurse's station. The night nurse glances up, recognizes her vaguely, doesn't stop her. She reaches bed 12. The patient's worse. Skin gray. Breathing shallow despite the ventilator. Blood pressure 82/50. The monitor alarm is muted. Someone silenced it. Elena's jaw tightens. She steps to the bedside, pulls back the blanket, and places her hand on his abdomen. Distended. Tense. Rigid in the lower. Hour quadrants. Free fluid. Blood. She's certain now. Behind her, a voice. You again. Dr. Trent. He looks exhausted. Scrubs wrinkled. Coffee stain on his chest. He's been here all night. Elena doesn't move her hand. He needs surgery. He's scheduled for a scan at 6. He won't make it to 6. Trent steps closer, voice strained. You keep saying that. Based on what? Based on the fact that his abdomen is full of blood. You don't know that. Yes, I do. Trent exhales sharply, rubbing his face. Look, I get it. You think you see something. But you're not a doctor here. You can't just... I was a trauma surgeon for 8 years. The words come out before she can stop them. Trent freezes, stares at her. What? Elena meets his eyes, doesn't blink. U.S. Army. Forward Surgical Team. Kandahar, Helmand, Mosul. I've done more trauma cases than everyone in this hospital combined. Trent's mouth opens, closes. Then why are you mopping floors? Because I lost my license. Silence. The monitor beeps, soft. Rhythmic. The patient's heart rate climbs. Trent looks at the screen, then back at Elena. If you were a surgeon, then you know you can't practice without... I'm not practicing. I'm telling you he's dying. Her voice is calm, steady, but there's weight behind it now. Trent hesitates, looks at the patient, at the monitor. His hand moves toward the phone on the wall, then stops. If I'm wrong, you're not. How do you know? Because I've seen this exact presentation 20 times, and every time, the outcome is the same. Internal bleed. Slow. Quiet. And if you wait for imaging, you're wheeling a corpse to radiology. Trent's hand hovers over the phone. Elena steps closer. Look at him. Really look. His skin's gray. His abdomen's rigid. His pressure's tanking despite fluids. He doesn't need a scan. He needs an OR. Trent stares at her for a long moment. Then he picks up the phone. Dials. This is Dr. Trent. I need an emergency OR for ICU bed 12. Suspected intra-abdominal hemorrhage. A pause. Now. He hangs up. Looks at Elena. If you're wrong, I'm done. I'm not wrong. 20 minutes later, the patient is wheeled into OR 3. Elena stands outside the observation window, arms crossed, watching through the glass. Dr. Cardoza scrubs in. She wasn't scheduled. She was called from home. Her face is unreadable. Trent's inside, gowned, gloved, assisting. The patient is draped, prepped. The anesthesiologist nods. Cardoza makes the first incision. Midline laparotomy. Fast, controlled. The moment she opens the peritoneum, blood wells up. Dark, venous, pooling in the abdominal cavity. Cardoza's eyes narrow. Suction. The scrub nurse hands it over. Cardoza suctions, clears the field. And there it is, a surgical clip, partially dislodged. Slipped off the cystic artery stump. Slow bleed. Steady. Lethal. Cardoza clamps it, ligates it properly. Checks for other sources. Finds none. She closes. The patient stabilizes. By the time Cardoza strips off her gloves, the sun is rising outside. She walks out of the OR, pulls down her mask, and sees Elena standing at the observation window. Cardoza stops. They look at each other through the glass. Then Cardoza pushes through the door, stands in front of Elena. You were right. Elena nods. How did you know? I saw it. During the first surgery. The liver looked off. The perfusion was slow. I knew something was wrong. And you didn't say anything. You wouldn't have listened. Cardoza's jaw tightens. No, I wouldn't have. Silence. Cardoza crosses her arms. Trent told me who you are. Elena doesn't respond. Captain Elena Navarro. Trauma surgeon. Decorated. Discharged after a field amputation in Kandahar that saved a soldier's life, but violated protocol. Elena's throat tightens. That's the short version. Cardoza steps closer. You've been mopping floors for 4 months. Watching us. Watching me. Seeing things we miss. I wasn't trying to. You saved that man's life. Twice. Once when you saw what I missed, and once when you refused to let it go. Elena looks away. Cardoza's voice softens. Just barely. Why didn't you tell anyone? Because no one would believe me. I would have. No. You wouldn't. Cardoza doesn't argue. She looks back through the observation window at the patient, stable now, being wheeled toward recovery. Then she turns back to Elena. Dr. Pruitt wants to see you. 9 a.m., his office. Why? Because what you did last night was either the best call I've ever seen or the most reckless thing that's ever happened in this hospital. She pauses. And I'm going to make sure he knows it's the first one. Cardoza walks away. Elena stands there. Alone in the hallway, the sound of the OR doors swinging shut echoing behind her. She looks down at her hands. Steady. Always steady. She touches the eagle pin on her collar. And for the first time in 3 years, she lets herself breathe. At 9 a.m., Elena sits across from Dr. Alan Pruitt in his office on the 5th floor. The room is neat, organized, certificates on the wall, a window overlooking the city. Pruitt's in his early 60s, steel-rimmed glasses, calm eyes. The kind of man who's seen everything and is surprised by nothing. He sets down a folder. Inside, printed copies of the patient's chart, the OR notes, the CT images that were never ordered, and a printable of Elena's service record. He looks at her. You saved a man's life last night. Elena nods. You also practiced medicine without a license, ordered imaging without authorization, overrode a resident's clinical judgment. Yes, sir. Pruitt leans back. If this were any other situation, I'd have security escort you out and file a report with the state board. Elena doesn't look away. But Dr. Cardoza tells me you saw a complication during the original surgery that no one else caught, and that you've been working here for 4 months without a single complaint. I do my job. You do more than that. He taps the folder. Captain Navarro. 8 years of service, 3 deployments, over 600 trauma surgeries, decorated twice. Discharged honorably after a controversial field amputation that saved a life but ended your career. Elena's hands tighten in her lap. Pruitt's voice is quiet, respectful. Why are you here? Because I couldn't practice anymore, and I didn't know what else to do. So you took a job mopping floors. It was the only way to stay close to the work. Pruitt nods slowly. Then he opens a drawer, pulls out a business card, and slides it across the desk. Elena picks it up. Dr. Isabel Tan, Chief of Trauma Surgery, Boston Medical Center. Pruitt leans forward. I'm calling in a favor. Dr. Tan owes me. She's going to review your case. If she agrees, we'll petition the state board for provisional reinstatement. Elena stares at the card. Why? Because people like you don't come around often. And when they do, you don't let them mop floors. Elena walks out of Dr. Pruitt's office at 9:43 with the business card in her pocket and no idea what happens next. She takes the stairs down to the second floor, pushes through the heavy door into the surgical wing, and nearly collides with a gurney being rushed toward the OR. Paramedics, 2 of them, faces tense. A woman on the stretcher, mid-30s, conscious but pale, hand pressed to her abdomen. Stab wound, one paramedic says to the trauma team waiting at the bay doors. Single entry, left upper quadrant, approximately 4 centimeters deep. Vitals stable but trending down. Doctor. Trent's there. He takes the hand off, starts barking orders. Get her to OR2, type and cross for 4 units. Someone page Cardoza. The team moves fast. Elena steps aside, back against the wall, watching. The woman's eyes are wide, scared. She's trying to speak, but the oxygen mask muffles her words. Trent leans over her. You're okay. We're taking care of you. But his face says something else. He's worried. Elena sees it in the way his hand hovers over the woman's abdomen without touching it, in the way he glances at the monitor and his jaw tightens. The gurney rushes past. Elena follows. She shouldn't, but she does. OR2 is prepped in minutes. The woman is transferred, draped, intubated. Cardoza arrives, already scrubbing in, face set. Trent's across from her, gloved, gowned, ready. Scalpel. Cardoza makes the incision. On, extends it. Enters the peritoneum. Blood, not pooling, pumping, arterial. Cardoza's eyes narrow. Suction, lap pads, now. The scrub nurse moves fast. Cardoza packs the abdomen, trying to isolate the source, but the blood keeps coming. Splenic artery, Trent says. Cardoza nods. I see it. Clamp. She reaches in. Her hands move fast, precise, but the tissue's friable, damaged. The clamp slips once, twice. She gets it on the 3rd try. The bleeding slows. Cardoza exhales. Okay, let's get control and see what else we're dealing with. Elena watches from the observation window, hands pressed against the glass. The surgery continues. Cardoza works methodically, checking for other injuries, repairing what she can. But something's wrong. Elena sees it, the way the blood's pooling in the retroperitoneal space, the way the tissue around the splenic hilum looks dusky. Ischemic. The spleen's not getting blood. Cardoza's focused on the artery, on the immediate bleed. She's not seeing the collateral damage. Elena's heart rate climbs. She looks around. No one else is in the observation room. She pulls out her phone, opens the hospital staff directory, finds the OR desk extension, dials. OR2. A voice answers. This is Dr. Navarro. I need you to relay a message to Dr. Cardoza. Who? Just please. Tell her to check the splenic hilum for ischemia. The spleen might not be viable. I can't just interrupt. She needs to know. Now. A pause. Hold on. Elena watches through the glass. The scrub nurse steps back, listens to someone on the intercom, then leans toward Cardoza and says something. Cardoza looks up, frowns. Then she looks at the spleen. Her hands move. She palpates the tissue, checks the color, the perfusion. Her face changes. She's necrotic, Cardoza says. We're taking it out. Trent blinks. The artery's controlled. We can leave it. No. Look at the hilum. There's no blood flow. If we leave it, she'll sepsis in 12 hours. Trent hesitates, then nods. Cardoza begins the splenectomy. Fast. Clean. She's done this 100 times. 20 minutes later, the spleen's out. The bleed's controlled. The abdomen's closed. The patient stabilizes. Cardoza steps back, strips off her gloves, and looks at the scrub nurse. Who called that in? The nurse hesitates. Someone named Dr. Navarro. Cardoza's eyes shift toward the observation window. Elena's still there. Their eyes meet through the glass. Cardoza pulls down her mask and walks out of the OR. Elena steps back from the window as the door opens. Cardoza stops in front of her. You called the OR desk. Yes. How did you see that? I was watching. The hilum looked dusky. The perfusion was off. From up here. Yes. Cardoza crosses her arms. You just saved that woman's spleen. Or rather, you saved her from keeping a dead spleen that would have killed her. Elena doesn't respond. Cardoza steps closer. Who are you? Before Elena can answer, the stairwell door bursts open. A man in his 50s, worn jeans, flannel shirt, graying hair pulled back in a ponytail. He stops when he sees Elena. His face goes pale. Navarro? Elena freezes. The man steps forward, staring at her like he's seen a ghost. Captain Elena Navarro, 82nd CSH, Kandahar. Elena's throat tightens. I'm not. You operated on my son. His voice cracks. 3 years ago, he was 19, trapped under a Humvee. You took his leg. The hallway goes silent. Cardoza looks between them. The man's eyes fill. The board called you reckless. My wife and I, we filed the complaint. We didn't understand. We thought. He stops, wipes his face. But Jason's alive. He's alive because of you. And last year, he told me the truth. He told me that if you hadn't done what you did, he'd have bled out before the medevac even got there. Elena's hands curl into fists at her sides. I'm sorry, the man says. I'm so sorry. I didn't know. I didn't understand what you did. He reaches into his jacket, pulls out a folded piece of paper, and hands it to her. Elena takes it, unfolds it. It's a letter, handwritten. Captain Navarro, my name is Jason Kowalski. You saved my life in Kandahar. I don't remember much, but I remember our voice. You told me I was going to be okay. You told me to hold on. I did. I'm in college now. I'm engaged. I'm alive because you didn't give up. I heard what happened. I heard you lost your license. That's not right. You're a hero. And I'm going to spend the rest of my life making sure people know that. Thank you. Jason Elena's hands shake, just slightly. She looks up at the man. He nods. He wanted me to find you, to tell you, to thank you. Elena's voice is barely a whisper. Is he okay? He's perfect. The man reaches out, squeezes her shoulder, and walks away. Elena stands there, letter in hand, chest tight, breathing shallow. Cardoza steps beside her, says nothing, just stands there. After a long moment, Cardoza speaks, quietly. You didn't just save lives. You gave them back. Elena folds the letter carefully, tucks it into her pocket. Cardoza looks at her. The board's meeting this afternoon. Pruitt's calling in Dr. Tan. They're going to review your case. Elena nods. And I'm going to be there, Cardoza continues, to tell them that you're the best trauma surgeon I've ever seen. Elena looks at her. Cardoza's face is steady, respectful. You belong in an OR, not behind a mop. Elena's throat tightens. Cardoza turns and walks back toward the surgical wing. Elena stays in the hallway, alone, the weight of the letter in her pocket, and the sound of her own heartbeat in her ears. She touches the eagle pin on her collar. And for the first time in 3 years, she doesn't feel like she's hiding. She feels like she's been found. At 2 p.m., Elena sits in a conference room on the 5th floor. Across from her, Dr. Pruitt, Dr. Cardoza, Dr. Isabel Tan, sharp-eyed and silent, reviewing a tablet, and Dr. Trent, who looks like he hasn't slept in 2 days. Dr. Tan sets down the tablet. Captain Navarro, I've reviewed your service record, your case files, your discharge summary. She pauses. And I've reviewed what happened here in the last 72 hours. Elena waits. Dr. Tan leans forward. You don't need a second chance. You need your license back. Elena's breath catches. I'm recommending full reinstatement, Tan continues. Provisional at first, supervised for 6 months, then unrestricted. She looks at Pruitt. And I'm recommending that Mercy General offer you a position. Trauma attending. Effective immediately. The room is silent. Elena stares at her. Pruitt nods. Agreed. Cardoza smiles. Trent exhales. About time. Elena's hands rest on the table. Steady. Always steady. She looks at them. All of them. And finally she speaks. Thank you. Elena spends the next 3 days in a fog of paperwork, credentialing meetings, and hospital orientations she's already lived through from the other side. She signs forms, sits through compliance training, gets a new badge with her name and the word physician printed beneath it. Dr. Elena Navarro, attending surgeon, trauma. She stares at it for a long time before clipping it to her scrubs. On the 4th day, she's scheduled to shadow Dr. Cardoza during morning rounds. Observation only. No patient contact yet. No procedures. Just watching. She meets Cardoza outside the ICU at 6:30 a.m. Cardoza hands her a tablet. Patient list is loaded. 3 post-ops, 2 admits from overnight, 1 pending transfer to step-down. Elena scrolls through the names. Stops. Bed 12. The man from the cholecystectomy. The one she saved twice. He's still here. Cardoza notices. He's doing well. Stable. Should discharge tomorrow. Elena nods. They move through rounds. Cardoza efficient, thorough, asking questions that make the residents think. Elena stays quiet, absorbing the rhythm, the language, the flow. It feels familiar. And foreign. She hasn't done this in 3 years. At 8:15, the trauma pager goes off. Cardoza glances at it. Multi-vehicle accident. Incoming. 2 critical. 3 stable. She looks at Elena. You're with me. They move fast, down the stairs, through the corridor, into the trauma bay. The first ambulance arrives at 8:23. Male, early 20s, unconscious, intubated in a field. GCS 3. Significant head trauma. Pupils unequal. Cardoza takes the handoff. Get him to CT. I want a full pan scan. The second ambulance is 30 seconds behind. Female, mid-40s, awake but combative. Chest trauma, steering wheel impact. Breath sounds diminished on the right. Cardoza's already moving to the next bay when Elena sees it. The woman's trachea, deviated, shifted to the left. Her neck veins are distended. Tension pneumothorax. Elena's body moves before her brain catches up. She steps to the woman's side, gloves already on, and places her hand on the woman's chest. The right side isn't moving. She looks at the monitor. Oxygen saturation dropping, 89%, 86. Cardoza's 10 feet away, managing the first patient. Elena makes the call. I need a 14-gauge needle. Now. The nurse beside her hesitates. Dr. Cardoza. She doesn't have time. Get me the needle. The nurse grabs it from the crash cart, hands it over. Elena counts ribs, finds the second intercostal space, mid-clavicular line. She plunges the needle in. There's a hiss. Air escaping under pressure. The woman gasps. Her oxygen saturation climbs. 92, 95, 98. Elena pulls the needle, preps for a chest tube. Behind her, Cardoza's voice. What happened? Tension pneumo. I decompressed her. Cardoza steps over, checks the woman, checks the monitor. Good call. Finish the tube. Elena places the chest tube in under 2 minutes. The woman stabilizes. Cardoza nods. You just saved her life. Elena strips off her gloves. Just doing the job. Cardoza's eyes linger on her for a moment. Then she turns back to the other patient. The rest of the morning is chaos. More ambulances, more patients. Fractures, lacerations, a ruptured spleen, a pelvic fracture that requires X-fix in the trauma bay. Elena moves through it like she never left. Her hands are steady. Her mind is clear. She doesn't hesitate. By noon, the trauma bay is quiet again. The critical patients are in surgery or ICU. The stable ones are in holding. Elena stands at the scrub sink, washing her hands, staring at the water circling the drain. Cardoza steps beside her. You did good work today. Elena nods. How's it feel? Like I never stopped. Cardoza dries her hands. You didn't. You just went quiet for a while. Elena looks at her. Cardoza's expression is calm, respectful. Welcome back, Dr. Navarro. She walks out. Elena stays at the sink, hands dripping, heart steady. She touches the eagle pin on her collar. Still there, still steady. At 2 p.m., Elena's in the attending lounge when the door opens. 2 men in uniform, army, dress blues. Her stomach drops. The first man is a colonel. Name tape reads Morrison. The second is a captain, younger, silent. Morrison steps forward. Captain Navarro. Elena stands. I'm not active duty, sir. Morrison pulls a tablet from under his arm. Respectfully, Captain. That's about to change. He turns the screen toward her. Department of the Army, Emergency Recall Orders. Captain Elena Navarro, MD. Recalled to active duty under Title 10 U.S.C., Section 12301A. Effective immediately. Elena stares at the screen. What is this? You're being recalled, Captain. I don't have a license. I'm not. You do now. Morrison swipes to the next document. Provisional medical license reinstated. By order of the Surgeon General of the United States Army. Elena's hands tighten on the edge of the table. We've been tracking your case for 2 years, Morrison says. Your actions here confirmed what we already knew. You're one of the best trauma surgeons we've ever trained, and right now, we need you. For what? Humanitarian mission, earthquake response, Caribbean deployment, field hospital. Wheels up in 18 hours. Elena's chest tightens. I just got reinstated here. I can't. You can, and you will. I'm not ready. Morrison's voice softens, just slightly. Captain, you decompressed a tension pneumothorax this morning in under 30 seconds. You placed a chest tube in 2 minutes. You saved a woman's life without hesitation. He steps closer. That's who you are. That's who you've always been. Elena looks at the recall orders, at her name. At the words active duty, Morrison hands her the tablet. You've got 16 hours to report to Hanscom. We'll have your orders, your gear, and your team waiting. Elena takes the tablet. Her hands don't shake. Yes, sir. Morrison salutes. Welcome back, Captain. He turns and walks out. The captain follows. The door closes. Elena stands there, tablet in hand, staring at the screen. Behind her, the door opens again. Dr. Cardoza. She sees the tablet. The uniform insignia still visible on the screen. They recalled you. Elena nods. When? 18 hours. Cardoza's silent for a moment. Then she crosses her arms. How long? 6 months. Maybe more. Cardoza nods slowly. And you better go pack. Elena looks at her. Cardoza's face is steady. You're needed there. Go. What about here? Here we'll be waiting when you get back. Elena's throat tightens. Cardoza steps forward. You're a trauma surgeon, Navarro. Doesn't matter if it's Boston or the middle of nowhere. You go where people need you. She extends her hand. Elena shakes it. Cardoza's grit this firm. Don't get yourself killed. Elena almost smiles. I'll try. Cardoza walks out. Elena stands alone in the lounge, tablet in hand, the weight of the recall orders pressing against her chest. She pulls out her phone, opens her messages, finds Jason Kowalski's father's number, saved from when he found her in the hallway. She types, "Thank you for finding me. I'm being recalled. I'm going back." She hesitates, then adds, "Tell Jason I'm still holding on." She sends it, sets the phone down, and walks out. At 4 p.m., Elena's in her apartment, packing, duffel bag, 2 changes of clothes, the med kit she never unpacked. Her phone rings, unknown number. She answers. Captain Navarro? Yes. This is Colonel Morrison. I wanted to follow up before you deploy. Okay. I know this is sudden, but I need you to understand something. What happened in Kandahar, the amputation, the complaint, it was politics, not medicine. You saved that kid. Everyone at command knows it. Elena's silent. The Surgeon General personally signed your reinstatement. That doesn't happen for just anyone. Why me? Because you don't quit, you don't hesitate, and you don't let policy get in the way of saving lives. Silence. Morrison's tone softens. You're not broken, Captain. You never were. Elena closes her eyes. Thank you, sir. Don't thank me. Just do what you do best. The line clicks. Elena sets the phone down. She looks at the silver eagle pin on her collar, unpins it, holds it in her palm, then pins it back on. At 10 p.m., Elena walks through Mercy General one last time. The halls are quiet. Night shift. Soft lights. The hum of machines. She takes the elevator to the ICU, finds bed 12. The man's awake, groggy, but stable. He sees her, frowns. Do I know you? Elena steps closer. No, but I know you. You're my doctor? Something like that. She checks his monitor. Vitals stable. Labs normal. You're going to be fine. Thanks to Dr. Cardoza, he says. Elena nods. Yeah, thanks to her. The man closes his eyes. Elena turns to leave. Wait. She stops. You were there, weren't you? In the OR. I remember your voice. Elena meets his eyes. Yeah, I was there. Thank you. Elena's chest tightens. You're welcome. She walks out, into the hallway, into the future. 6 months later, Port-au-Prince, Haiti. The air tastes like dust and salt and burning fuel. Elena stands outside a canvas tent that serves as operating room 2, sleeves rolled to her elbows, hands scrubbed clean but stained at the creases with betadine that never fully washes out. Behind her, the steady hum of generators, the distant thump of helicopter rotors, voices calling in Creole, French, English, all blending into the soundtrack of organized chaos. She's been here for 23 weeks. She's operated on 416 patients. She's lost 9. She's saved 407. Her hands don't shake anymore. They never do. A young medic approaches. Private First Class Chen, 22, sharp, fast learner. Reminds her of someone she used to know. Captain, incoming, crush injury, pregnant. T female, 32 weeks. HEA 2 minutes. Elena nods. Prep OR2. I'll scrub. Yes, man. Chen runs. Elena walks to the scrub station. Soap, water, the rhythm so ingrained she doesn't think. She just moves. The patient arrives on a stretcher, carried by 2 local volunteers and a paramedic from Doctors Without Borders. Woman in her late 20s, conscious, crying. Her right leg is trapped under a concrete slab. They cut her free 20 minutes ago. The leg is mangled, femur exposed, blood everywhere. But Elena's eyes go to the woman's abdomen first, distended, tight. Fetal heart tones audible but irregular. She's in labor. Elena's jaw tightens. Get her inside, now. They move fast. The woman is transferred, draped, prepped. The anesthesiologist, a French doctor named Laurent, starts the line. Elena checks the fetal monitor. Heart rate 130. Decelerations with each contraction. The baby's in distress. She looks at the woman's leg, shattered, infected. She can smell the necrosis from 3 feet away. Laurent looks at her. We need to choose, the leg or the baby. Elena's voice is calm. We're doing both. Laurent's eyes widen. Elena, we're doing both. She turns to Chen. Get me an OB kit. And call for a neonatal team if we have one. We don't. Then we'll manage. Chen moves. Elena starts with the leg. She irrigates the wound, debrided the dead tissue, assesses the bone. The femur is fractured in 3 places. The femoral artery is intact but compromised. If she tries to save it, the woman might lose too much blood. If she takes it, the woman loses the leg but keeps her life. And the baby. Elena makes the call. Amputation. Mid-femoral. She works fast. Tourniquet, incision, bone saw, ligation. She's done this before. Kandahar. A 19-year-old kid trapped under a Humvee. She pushes the memory away. Focuses. 20 minutes later, the leg is off. The stump is closed. The bleeding is controlled. Now the baby. Elena moves to the woman's abdomen. The contractions are stronger now, closer together. She checks the cervix. 8 centimeters dilated. The baby's coming. She looks at Laurent. We're doing this here, in the field tent? Yes. Laurent nods. Elena delivers the baby 12 minutes later. A girl, small, premature, but breathing. Chen wraps her in a blanket, suctions her airway, rubs her back until she cries. The sound fills the tent. Elena closes her eyes for just a moment. Then she goes back to work. She repairs the woman's uterus, checks for other injuries, closes the abdomen. The woman stabilizes. The baby stabilizes. Elena steps back, pulls off her gloves, and leans against the tent pole. Her hands are shaking now, just slightly. Chen steps beside her. That was incredible. Elena doesn't answer. She looks at the woman, at the baby, at the impossible, exhausting, life-saving work that never stops. Chen hands her a bottle of water. You okay, Captain? Elena takes it, drinks. Yeah, I'm okay. She's not sure if she believes it, but she says it anyway. That night, Elena sits outside her tent, back against a supply crate, staring at the stars. Her phone buzzes. Service is spotty here, but sometimes messages get through. She checks it. A text from Dr. Cardoza. Pruitt officially cleared your reinstatement. Full license, no restrictions. Jobs waiting when you're ready. Elena stares at the message for a long time. Then she types back. Thank you. I'll let you know. She pockets the phone, looks at the field hospital, at the lights glowing inside the tents, at the patients waiting, at the medics moving between stations, at the work that never stops. And she realizes something. She's exactly where she's supposed to be. 3 months later, Mercy General Hospital, Boston. Elena walks through the main entrance at 6:45 a.m. She's in clean scrubs, a hospital badge clipped to her collar. Dr. Elena Navarro, MD. Attending surgeon, trauma. She takes the elevator to the 3rd floor, stops outside the trauma bay. Dr. Cardoza's inside, reviewing a patient board. She looks up, sees Elena, smiles. You're late. I'm exactly on time. Cardoza hands her a tablet. Wet. Good. Because we've got a ruptured spleen in OR3, and I need someone who won't hesitate. Elena pulls on a gown. Let's go. The surgery is flawless. Afterwards, Elena walks through the ICU. The same hallways she used to mop. The same monitors she used to watch in silence. Now she's the one writing orders. Now she's the one they call when no one else knows what to do. She passes bed 12. A different patient now. A teenage girl recovering from a car accident. Elena checks her chart. Stable, healing. The girl's mother is sitting beside her, holding her hand. She looks up at Elena. Thank you, doctor. Elena nods. She's strong. She'll be fine. The mother's eyes fill. You saved her life. Elena pauses, then says, quietly, that's the job. She walks out. At 3 p.m., Elena's paged to the conference room. She walks in. Dr. Pruitt's there. Dr. Cardoza, Dr. Trent, and someone new. A woman in her early 50s. Silver hair. Sharp suit. Calm eyes. Pruitt stands. Dr. Navarro, this is Dr. Isabel Tan. She's the new chief of trauma surgery at Boston Medical Center. Tan extends her hand. I've heard a lot about you. Elena shakes it. Likewise, I'm here because we're launching a new initiative. A joint trauma training program between Mercy General and Boston Med. High-intensity, real-world simulation based on battlefield protocols. Elena's eyes narrow. Why? Because trauma doesn't wait for perfect conditions. And most civilian hospitals aren't ready for the kind of chaos you've seen. Tan steps closer. We want you to lead it. Elena stares. Me? You've operated in war zones. You've run mass casualty events. You've saved lives under conditions most surgeons can't imagine. Tan's voice is steady, respectful. You're exactly who we need. Pruitt adds, it's a teaching role, part clinical, part leadership. You'd be training the next generation of trauma surgeons. Elena looks at Cardoza. Cardoza nods. You should do it. Elena looks back at Tan. When do we start? Tan smiles. Tomorrow. That night, Elena sits in her new office. Small, cluttered, full of case files and trauma protocols, and a desk she's still getting used to. On the wall, a framed photo. Her old unit in Kandahar, 30 faces, dusty uniforms, tired smiles. Half of them didn't come home. She looks at it for a long time. Then she opens her laptop and starts writing. A training manual. Field trauma protocols for civilian emergency medicine. She types for 3 hours. When she's done, she leans back, closes her eyes, and smiles. 6 months later, Mercy General Hospital, simulation lab, a room built to look like a disaster scene. Smoke machines, moulaged actors, fake blood, real pressure. 12 residents stand in the center, wide-eyed, overwhelmed. Dr. Elena Navarro walks in, calm, steady. You've got 3 patients, 2 critical, 1 expectant. You've got 6 minutes before the next wave hits. She looks at them. What do you do? One resident steps forward, hesitates. Elena's voice is firm, but not unkind. Don't think. Move. The resident nods and moves. By the end of the day, 10 of the 12 pass. They're exhausted, shaking. Some are crying. But they did it. Elena stands at the back of the room, watching them debrief with Cardoza and Tan. Trent walks up beside her. You're good at this. At what? Teaching, leading. Not giving up on people. Elena looks at him. You didn't either. You could have had me fired. You didn't. Trent shrugs. I was wrong. So was I. A lot of times. He smiles faintly. Difference is, you were wrong and people still lived. Elena almost laughs. That night, she sits in her office, staring at the framed photo on the wall. Her unit, her past, her foundation. She touches the eagle pin on her collar. Still there, still steady. She opens her laptop, begins the next chapter of the manual, and keeps moving forward. 5 years later, Mercy General Hospital. The trauma simulation lab has grown. What started as a single room with smoke machines and mannequins is now an entire wing. 4 simulation bays, a debriefing theater, a research division, a trauma skills lab with real surgical equipment and tissue models. DELS, the program trains 60 residents a year now. Surgeons, emergency physicians, nurses, paramedics. They come from across the country. Some come from across the world. They all come to learn from Dr. Elena Navarro. She stands in Simulation Bay 3, arms crossed, watching a team of 4 residents manage a multi-casualty scenario. Building collapse. 6 patients, limited resources, no backup. The residents are moving, but they're hesitant, overthinking. One of them stops in front of a patient with a tension pneumothorax, needle in hand, frozen. Elena steps forward. What's the problem? The resident, a woman in her late 20s, aimed Dr. Patel, looks up. I don't want to miss. You won't. How do you know? Because you've done this 50 times in here. Your hands know what to do. Trust them. Patel hesitates. Then she places the needle, decompresses the patient. The simulation monitor beeps. Oxygen saturation rises. Patel exhales. Elena nods. Good, now move to the next one. The scenario continues. By the end, 4 patients survive, 2 are lost. The residents are shaking, exhausted. Elena gathers them in the debriefing room. Talk to me. What happened? Patel speaks first. We lost time on the first patient. I hesitated. Why? I was afraid of making a mistake. Elena's voice is calm. You'll make mistakes. Everyone does. The question is whether you let fear stop you or whether you move anyway. She looks around the room. You saved 4 people today. You did that under pressure, with limited resources, in chaos. That's the job. One of the other residents, Dr. Lin, raises his hand. How do you not freeze? How do you just know what to do? Elena pauses. You don't always know, but you act anyway. Because hesitation kills more people than mistakes ever will. The room is silent. She continues. I've lost patients, more than I can count. Some because I wasn't fast enough. Some because there was nothing I could do, but I've saved a lot more, and the only reason I could save them was because I didn't stop to second-guess myself. She looks at each of them. That's what we're teaching you here. Not perfection, not fearlessness, just the ability to keep moving when everything's falling apart. The residents nod. Elena dismisses them. As they file out, Dr. Cardozo walks in. She's older now. Gray hair fully silver, reading glasses perched on her nose. She retired from active surgery 2 years ago but stayed on as an instructor. She watches the residents leave, then turns to Elena. You're good at this. Elena shrugs. I'm just telling them what someone should have told me. Someone did, you just didn't listen. Elena almost smiles. Cardoza steps closer. The board approved the expansion. We're breaking ground on the new institute next month. Elena looks at her. The institute? Cardoza pulls out a tablet, turns it toward her. On the screen, architectural renderings, a new building, 3 stories, state-of-the-art simulation labs, lecture halls, research facilities. At the top of the first image, a name, the Navarro Trauma Institute. Elena stares. No. Yes, I didn't ask for this. You didn't have to. The board voted unanimously. Pruitt insisted. So did Tan. So did I. Cardoza's voice softens. You've trained over 300 surgeons in 5 years. Your protocols are being used in hospitals across the country. You've saved thousands of lives, not just as a surgeon, but as a teacher. She pauses. You've earned this. Elena's throat tightens. I don't know what to say. Say you'll keep doing what you're doing. Elena looks at the screen, at the building, at her name. Okay. Cardoza smiles. Good, because we're announcing it tomorrow. The next day, Mercy General holds a press conference. The auditorium is packed. Reporters, hospital staff, former residents, local officials. On stage, Dr. Pruitt, Dr. Tan, and Dr. Elena Navarro. Pruitt steps to the microphone. 5 years ago, we launched a trauma training program built on one principle, that life or death decisions require life or death training. He gestures to Elena. Dr. Navarro didn't just teach our residents how to operate. She taught them how to think under air pressure, how to act when the system fails, how to refuse to give up. Applause. Elena stands at the side of the stage, uncomfortable with the attention, arms folded. Pruitt continues. Today, we're proud to announce the construction of the Navarro Trauma Institute, a facility dedicated to advancing trauma care through education, research, and innovation. More applause. Pruitt looks at Elena, and we're even prouder to announce that Dr. Navarro will serve as its founding director. The room erupts. Elena steps forward, takes the microphone. The room quiets. She looks out at the crowd, at the residents she's trained, at the nurses who watched her mop floors, at Cardoza, sitting in the front row, smiling, at Trent, standing near the back, arms crossed, nodding. I'm not good at speeches, so I'll keep this short. She pauses. 5 years ago, I walked into this hospital with nothing. No license, no future, just a mop and a lot of regret. I thought I was done. I thought I'd lost everything that mattered. But I was wrong. She looks at Cardoza, at Tan, at the residents. Because the only thing that matters in this job, the only thing, is whether you show up when it counts. Not when it's easy, not when it's convenient, but when someone's dying and no one else knows what to do. Her voice is steady, strong. That's what we teach here. That's what we live here. We don't give up. We don't hesitate. We don't walk away. She looks directly into the crowd. And if you're here because you want to learn that, because you want to be the person who refuses to let someone die, then welcome. This is where you belong. The room is silent for a beat. Then the applause starts, and it doesn't stop. After the ceremony, Elena walks through the hospital. She passes the trauma bay, the ICU, the OR wing. She stops in front of a wall near the main entrance, a memorial wall, engraved names. Patients saved by the program's graduates, over 2,000 names now, and counting. Elena reaches out, touches the wall, closes her eyes, and breathes. That evening, she sits on the hospital roof, her thinking spot. Dr. Cardoza's already there, leaning against the railing, coffee in hand. Thought I'd find you here. Elena steps beside her. You know me too well. They stand in silence for a moment. Cardoza speaks first. You did it. We did it. No. Cardoza looks at her. You did. You took a second chance and turned it into something that's going to save lives for decades. Elena doesn't answer. Cardoza smiles. You were right, you know. That first day, in the ICU. About what? About not giving up. Elena looks at her. Cardoza raises her coffee. To not giving up. Elena smiles. To not giving up. Later that night, Elena sits in her office. She opens her laptop, pulls up an old email. The one she sent to Dr. Cardoza 5 years ago. The one that almost got her fired. She rereads it. Then she opens a new message. From Private First Class Darren Chen. To Captain Elena Navarro. Subject. Thank you, Captain. I just finished my residency. I matched into trauma surgery at Johns Hopkins. I wanted you to know. Everything I learned from you. In Haiti, in the field, in the moments when I thought I couldn't do it, and you told me I could. I'm never going to be as good as you, but I'm going to try. Thank you for not giving up on me. Chen Elena closes the laptop, leans back, and smiles. She looks at the silver eagle pin on her desk. She stopped wearing it a year ago. Not because she's leaving it behind, but because she doesn't need it anymore. She knows who she is. She's a trauma surgeon. She's a teacher. She's someone who refuses to give up, and that's enough. 10 years later, the Navarro Trauma Institute stands on the east side of Mercy General's campus. Glass and steel rising 4 stories above the Boston skyline. Inside, the walls are lined with plaques, names of graduates, research publications, lives saved. Dr. Elena Navarro walks through the main corridor at 7 a.m., tablet in hand, reviewing the day's schedule. She's 51 now, gray streaks in her hair, lines at the corners of her eyes, but her hands are still. Still steady, her mind still sharp. She's trained over 800 surgeons, published 43 papers on trauma care, consulted on hospital protocols in 12 countries. But today, she's doing what she loves most, teaching. Simulation Bay 1 is already set up when she arrives. The mock disaster scene, train derailment, 15 casualties, limited resources. 8 residents wait inside, scrubbed, gowned, nervous. Elena steps in, looks at them. You've been training for 6 months. Today, you prove you're ready. She nods to the simulation tech. Start the clock. The scenario begins. Chaos. Alarms. Smoke. Actors screaming. The residents move. Some hesitate, some freeze, but they move. Elena watches from the observation deck above, arms crossed, eyes tracking every decision, every hesitation, every moment of doubt. One resident, Dr. Sarah Mills, 28, kneels beside a patient with a suspected spinal injury. She's afraid to move him. Elena's voice comes through the speaker. What's the problem, Dr. Mills? I don't want to make it worse. If you don't move him, he dies. Choose. Mills hesitates. Then she stabilizes the spine, log-rolls the patient, clears the airway. The patient's oxygen saturation climbs. Elena nods. Good. Keep moving. The scenario runs for 40 minutes. By the end, 12 patients survive. 3 are lost. The residents are shaking, exhausted. Elena gathers them in the debriefing room. Talk to me. What happened? Mills speaks first. I froze. I was afraid. Why? Because I didn't want to hurt him. Elena's voice is calm. You'll hurt people. Not intentionally. But it will happen. The question is whether you let that fear paralyze you, or whether you act anyway. She looks around the room. You saved 12 people today. That's not luck. That's training. That's skill. That's refusing to give up. Another resident, Dr. Jamal Carter, raises his hand. How do you live with the ones you lose? Elena pauses. You carry them. Every single one. But you don't let them stop you from showing up for the next patient. She looks at him directly. I've lost more patients than I care to count, but I've saved thousands more. And the only way I could do that was by choosing to keep moving forward. The room is silent. Elena dismisses them. As they leave, Dr. Isabel Tan walks in. She's in her mid-60s now, semi-retired, but still active on the Institute's board. She watches the residents file out, then turns to Elena. They're getting better every year, because you don't let them quit. Tan smiles. Neither do you. She hands Elena a folder. This came in this morning. An invitation. Elena opens it. Department of Defense, Pentagon. A request for Elena to present her trauma protocols to the Joint Chiefs of Staff. Elena stares at it. Why me? Because your methods are saving lives in combat zones, civilian hospitals, disaster sites. They want to make them standard across all military medical training. Tan pauses. You've changed the way we teach trauma care, Elena. Not just here, everywhere. Elena closes the folder. When? 3 weeks. She nods. I'll be there. That evening, Elena sits in her office, staring at the folder. On her desk, a letter, handwritten, delivered that morning. She opens it. Dr. Navarro, you don't know me, but you saved my mother's life 10 years ago. She was in a car accident. You were the attending surgeon. You refused to give up on her when everyone else said it was too late. She lived. She's healthy. She got to meet her grandchildren. I'm in medical school now because of you. I want to be the kind of doctor who doesn't give up. Thank you for showing me what that looks like. Respectfully, David Harmon. Elena sets the letter down, closes her eyes, and smiles. 3 weeks later, Elena stands in a conference room at the Pentagon. In front of her, 30 officers, surgeons, generals, chiefs of medical staff from every branch. She presents for 90 minutes. Field trauma protocols, decision-making under pressure, training methods that simulate real chaos. When she finishes, the room is silent. Then a general in the back stands, applauds. The rest follow. Afterwards, Colonel Morrison approaches. He's older now, retired, but still sharp. Captain Navarro, or should I say Dr. Navarro. Elena shakes his hand. Colonel, you've done remarkable work. The protocols you've developed are going to save thousands of lives. I hope so. Morrison's voice softens. You know, when we recalled you 10 years ago, I wasn't sure you'd make it. You'd been out for so long. Elena looks at him. I wasn't sure either. But you did. And you didn't just survive. You thrived. He pauses. You're exactly who we needed you to be. Elena nods. Thank you, sir. Morrison salutes. She returns it. 5 years later. Mercy General Hospital. The Navarro Trauma Institute has expanded again. A 5th floor, a research wing, an international training center. Dr. Elena Navarro is 56 now. She still teaches, still operates, still refuses to give up. She stands in Simulation Bay 4, watching a new class of residents manage a mass casualty event. One of them, a young woman named Dr. Lin Chen, daughter of the medic Elena trained in Haiti, places a chest tube with steady hands. Elena watches, nods. Well done. Chen looks up, smiles. I learned from the best. Elena steps back, lets the scenario continue. That night, she sits on the hospital roof one last time. Dr. Cardoza passed away 2 years ago, peacefully, surrounded by family. But Elena still comes here, to think, to remember, to breathe. She looks out over the city, the lights, the movement, the life that never stops. Her phone buzzes. A message from Dr. Patel, now an attending at a hospital in California. Just saved a kid with attention pneumo. Thought of you. Thank you for teaching me not to hesitate. Elena smiles, types back. Proud of you. Keep moving. She pockets the phone, looks at the sky, and thinks about the soldier in Kandahar, the one whose leg she took, the one who lived. She thinks about the man in bed 12, the one she saved twice. She thinks about the residents she's trained, the lives they've saved, the lives they'll continue to save. And she realizes something. She didn't just get a second chance. She built a legacy. Not through heroism, not through perfection, but through refusal. Refusal to quit. Refusal to let fear win. Refusal to walk away when someone needed her. She stands, walks to the edge of the roof, looks down at the institute below, her name on the building, her work in the walls, her students in the world. She touches the place on her collar where the eagle pin used to be. It's not there anymore, but she doesn't need it. She knows who she is. She's Dr. Elena Navarro, trauma surgeon, teacher, leader, someone who refused to give up, and that's enough. The next morning, Elena walks into Simulation Bay 1. A new class of residents waits inside. 12 of them. Young, nervous, hopeful. She looks at them. You're here because you want to save lives. That's good. But it's not enough. She steps forward. You're going to see things that break you. You're going to lose patience. You're going to make mistakes. You're going to doubt yourself. She pauses. But if you want to do this job, really do it, you have to learn one thing. She looks each of them in the eye. Don't think. Move. Don't hesitate. Act. Don't give up. Ever. The residents nod. Elena steps back. Let's begin. The simulation starts. Alarms. Chaos. Smoke. The residents move. Some hesitate. Some stumble. But they move. And Elena watches. Steady. Calm. Proud. Because this is her work. This is her legacy. Not the building. Not the awards. Not the recognition. But the people she's trained. The lives they'll save. The refusal to give up that she's passed on to them. She steps out of the observation room. Walks down the corridor. Past the memorial wall. Past the research labs. Past the classrooms filled with students learning to be better. She walks out into the morning light and smiles. Because she's exactly where she's supposed to be. Not behind a mop. Not hiding from her past. But standing in her future. Teaching. Leading. Saving lives. One student at a time. One patient at a time. One refusal at a time. The end.